Welcome to the European Social Networks podcast series. In this podcast, you will listen to the stories and voices from frontline social services across Europe. How are social services structured across European countries? What strategies do they have in place for transforming social services to adapt to the evolving needs of society? Or how can projects that focus on social inclusion be funded from European structural funds? These are just some snapshots of topics we are going to discuss in this podcast series.
Hello, I'm Alfonso Lara Montero, CEO of the European Social Network, or ESN in short. Welcome to our new episode of ESN Talks, our regular podcast to share insights on different aspects of social services, policy and practice from across Europe. Before we start, a short introduction to the European Social Network. ESN is a growing community of more than 180 member organizations with responsibility for social services in 33 countries. We provide an international platform for knowledge exchange and building on social services and social inclusion, and aim to empower professionals and those using social services. If you would like to know more about us and the work we do, you can visit our website at www.esn-eu.org. ESN Talks aim to highlight the incredible work professionals working in social services do to improve people's lives. But this is a special edition because we've got the European Parliament elections just around the corner. Therefore, today's podcast episode will focus on the key priorities for social services that we would like the next European Parliament and European Commission to take up. We recently published a briefing with proposals for policy initiatives on social inclusion and social services for future members of the European Parliament and lead candidates for the European Commission Presidency. This briefing is based on the analysis of the answers to a questionnaire that we shared with our members and proposes European political parties 3 key actions that they should include in their programs to strengthen social inclusion in relation to the financing of social services, quality of social services, and the workforce. More specifically, we would like MEPs to work to support the transition of social services towards a more integrated, person-centered, and community-based model. We would like investment in the social services workforce, smart investment to enhance skills, recruitment, retention, and well-being. We'd like to ensure that quality is centerpiece with a renewed quality framework, which is developed at European level. We would like to ensure sustainable EU funding and financing for social services that complement funding at national level. Today with us, we have the pleasure to welcome 2 ESN members to discuss these points in detail and explore how their national experiences can be relevant at European level too. I'd like to warmly welcome Kathleen Wabrowetz, who is head of the International Affairs Department at the Association for Public and Private Welfare in Germany. How are you doing today, Kathleen?
Thank you, I'm very good.
And we've also got with us Arnaud Lopez, who is member of the Board of ANDASS, the National Association of Social and Health Directors in France. How are you doing today, Arnaud?
Hi, Alfonso. Fine, thank you.
Great to have you both with us. I'd like to ask you to introduce yourself. Kathleen, thank you for joining us. Can you briefly tell our listeners about yourself as we start this podcast today?
Yes, thank you very much. So basically, I'm working for the German Association for Public and Private Welfare. We are a platform for social policy and social service provision, which includes members from social service providers and municipalities and other actors. At the international department, we are very much looking at the European developments and how they are relevant for our members. This is basically focusing on social policy and funding.
Thank you, Kathleen. Arnaud, thank you for joining us today. Can you please take a moment to introduce yourself to our listeners?
Yes, of course. So I'm a Director of Child Protection and Family Support in a county council in France, in the west side of Paris. Because, in France, county councils are responsible for all the social policies. My association, ANDASS, represents nearly 80 county councils in France. The county councils responsible for social and welfare policy employs almost 50,000 professionals, going from social workers to nurses, and we provide 4.2 million social benefits each year.
Thank you both. It's great to have you with us. You hold so much knowledge in social services in your countries, in Germany and France, that I'm sure this conversation is going to be excellent looking into the European elections coming up. Kathleen, if I may start with you, from your perspective, what can future MEPs do to promote a more integrated, person-centered and community-based model for social services and social care?
I think basically the most important thing is to secure that we will have enough resources. We have certain funding sources, like the European Social Fund, for example, that is helping us also at national level to develop our social services and the quality of social services. In Germany, we have a particular program for that. And in securing that also in the next funding period, we have enough resources to maintain those funding schemes.
Thank you. And Arnaud, from your experience looking at the situation in France, are there any experiences that you might be able to bring to the European level also to foster this idea of having a more integrated person-centered model of social services?
Yes, at ANDASS, we are convinced that only an integrated response can guarantee the quality but also the adaptation of the responses for the public's needs. Those when it comes to the integration, for example, and support of young migrants, which is a challenge, as you know, in many European countries, the answer can only address on one field of responsibility. It could be one child protection on one hand and social inclusion on the other. In fact, we have to build social services that provides both in itself. It's only a coordinated and comprehensive response that must be built, often between local authorities and the state, and of course on a European scale.
Let's turn now to the question of quality. As important as access to social services, quality is very important across Europe to ensure that the services that are being provided, delivered to people in need, help them achieve the best possible outcomes in life. What do you think, Kathleen, can be done at European level to promote quality in social services?
I think it would be necessary to support national developments by creating a quality framework also at European level that also enables, for example, migration between the EU member states and make it easier to get qualifications recognized. But this is something very concrete at European level, but also to provide a common framework for criteria and social services might be very helpful.
Arnaud, a similar question to you. What do you think could be done at European level to support you locally to ensure quality in social services?
First, each member state in the members going from local authorities or national at the national level, all the professional has to make sure that in each member state the principle of participation, public representation are implemented as provided, of course, at the community law and the European level, but also on the programs developed by the European Union, such as the European Children's Guarantee, which has been a real impact on every policy, for example, in child protection policy in France since 2022. It is by restarting that mission and no longer focuses on each status that we can renew practices and that can increase also the attractiveness of social work in each member state, and also that we guarantee that in each state we have the same right for the same public.
In a way, both of you speak about the importance of having a European framework that can then help those locally developing and improving quality in their services. I was wondering a similar question to both of you, whether there are any practices, any programs in your countries or that you know of elsewhere that you think could be relevant for MEPs to take inspiration to, let's say, move this agenda forward. Maybe if I can ask first, Kathleen.
Yes, I already mentioned this briefly in the beginning. We have a very interesting funding scheme that is particularly focusing on the needs of social service providers in Germany. And it is developed in a co-design process. So funding agency and the relevant actors are drafting this program for this funding scheme together. I find this a very good example of how co-creation can provide tailored funding schemes and programs that is actually addressing the needs of social service providers. And I think this is a very good example that could be spread amongst other EU member states.
Thank you. A similar question to you, Arnaud.
At ANDASS, we try to develop new framework to encourage social workers to make also crosswords and to get training during all their work. I mean, it's not only to gain a status or to gain a diploma, but to have access to training all over your path and all over your daily work. So we believe that local authorities should improve, and it's a good example that we try to develop programs not only to train social workers, but also to make a culture common with social policy, house policy, and to have a very holistic approach of the public needs.
Thank you. Kathleen, earlier on you referred to examples of innovative funding. How vital do you think sustainable EU funding and financing for social services is? And in your opinion, what measures could future MEPs propose, put forward to ensure that funds are used effectively for the development of social services across member states?
Funding, of course, is a key issue for us as social service providers, as we are very dependent on it. And the good thing about European funding has been always that there's a high level of predictability. So we have a 7-year period. And this 7 years, we know exactly what is going to happen, what kind of resources are available. And we can go in conversations with our ministries and those actors that are relevant for implementing those fundings in order to have funding schemes. Compared to national funding, this is a very big advantage because national funding is mostly very short term and very predictable. If in the following year those funding resources are still available. In that sense, it is quite important to keep this long-term planning aspect and predictability. I heard that there are considerations of shortening the multi-annual fund framework to a shorter time of 5 years. So in that sense, I would be very much against this. It's quite good to have this long-term planning. And regarding the actual implementation, I think EU funding sources have those mentioned advantages, but the big disadvantage is quite bureaucratic and barriers to actually access the funding. So to lower those barriers, make it easier to access and to implement the funding is super, super relevant.
Many thanks, Kathleen, for these insights. Arnaud, for you who are working at a local level, directly providing, delivering services for people, I was wondering how vital is sustainable EU funding and financing for social services, and what, in your opinion, could MEPs do to ensure the sustainability of that funding?
At ANDASS, we published in January 2024 a contribution highlighting the role of Europe in social policy. We don't think always about Europe as a social framework, but also providing programs to reinforce social cohesion. For example, for the period 21 to 27, the European Social Fund Plus, which includes the initiative for youth employment and assistance to the most disadvantaged, represent in France an amount of 6.7 billion euro. It was just 5.5 billion in 2014 to 2020. Within this amount, food aid, for example, represents 600 million euros for France. So Europe is not only a framework for basic human rights, it's also a way to reinforce our policy. Of course, as I explained, in France, the social policy are mainly led at the local level. But, the challenge is not only financing. And if I had to make an advice for future MPs and for future French MPs, it's also important to reflect how to better coordinate. In France, recently, a parliamentary report shows that all the entanglement and all the mix of responsibilities between the state, the local authorities, and also between local authorities itself has a cost that can be estimated at 7.5 billion euro. So yes, it's also important to draw inspiration from the governance of social policies to simplify, but also to responsible each level for social policies. I'm thinking, for example, of Finland with the deployment of Conta, which is, I think, for France, a source of inspiration for better coordination of response between the healthcare system and the social system.
Thank you so much, Kathleen and Arnaud, for joining us, for sharing with us your insights and experiences as well about how to bring forward priorities for social services over the next years. Indeed, we have a stark choice in front of us at a time when populist forces are significantly rising. We at Social Services have a duty to promote the values and principles of social justice and social protection. We hope that with this podcast we've contributed to this, and we certainly will continue to do so over the years to come. Thank you again, Kathleen and Arnaud, for being with us today, and thank you also to our audience for listening. If you want to know more about the work of ESN and social services, follow the links in the podcast description and sign up to our newsletter so that you don't miss the next episode. Thank you and have a good day. You said earlier that the situation of quality in social services still requires significant improvements in Spain. So I was wondering if you could maybe either give a concrete example of how having in place a quality assurance system in social services has impacted or could impact the lives of the people using those services.
Yeah, I mentioned above the some changes are being in place in Spain in terms of structures, in terms of a single room, in terms of the size of the nursing homes, in terms of participation of the users of service in the direction of the service. So I think that there is a lot of different way of working in the services, in the nursing homes, in the healthcare services that are impacting very, very strongly the quality of life of users.
If I could ask the same question to you, Dave, could you tell us a concrete example of how having in place a quality assurance system in England has impacted the lives of people using social services and social care?
Yes, I'm just thinking about the work we've done for services for people with a learning disability or autism. There is a nationally recognised programme of best practice for how that care should be delivered, and in particular, the types of settings, residential settings that are appropriate, and those that aren't. And this is off the back of a number of horrifying cases that happened a number of years ago, of very poor care. So following on from that, this model of best practice was developed, and we've adopted that in our regulatory approach. And that's very much about a genuine home environment and genuine choice for people that are living in a home but have a learning disability, as opposed to very large institutional settings which are at risk of closed cultures developing and where abuse and harm can occur. So using our levers, our regulatory levers, such as who we allow to register and who we the standards that we apply and then the legal action that we may go on to take, we have improved the market essentially of those services for people with a learning disability, and we maintain a view, and we only let the appropriate and those services that meet best practice into that market. And that remains a big focus for us currently.
Both Joseba and Dave refer to a number of examples around the areas of personalization, making sure that people can be supported in their own homes or in facilities which resemble a home in their communities, trying to get away from that institutional culture that for so long has been implemented in a number of centers when it comes to social care and support. And this is really interesting as to how we are seeing more and more coherence between different approaches across Europe. But of course, our members coming from public authorities across Europe work in very different national systems, in the way they are structured and in the way they are regulated. And of course, this also applies to ensuring the quality of social care and social services. Based on your professional experience in Spain and England, what would you recommend public authorities focus to ensure quality social services at different governance levels? Maybe I can ask first Joseba.
I think that from the perspective of Spain and from the perspective maybe of Southern European countries, I think that I will focus on 5 recommendations. In my opinion, it's important first to create structures. I mean, to create independent authorities with the task of setting quality standards and evaluating services, as in England, where the Care Quality Commission, or in Scotland, or in Wales, or in Sweden. I think that the institutionalization of the evaluation and the scrutiny and the inspection task and the standard setting task is important to have some structures who can do that work. I think that this is, from the point of view of Spain, one of the first recommendations. The second recommendation will be to focus the evaluation of services on outcome indicators related to the user's quality of life, when I said before. I think also it's important to focus and to promote continuous improvement processes in the service. I mean, to guide and help organizations on the road to improvement. I think that there is a important task of that kind of agencies and authorities helping the organization and the professionals and in the road to the improvement. I think that is important also to ensure the transparency of evaluations and provide users, and not only users, citizens and all the stakeholders, with all the information they need to service. And finally, I think that is important, and maybe one of the important hot topics here now in Spain, to involve and motivate professionals. In Spain, the quality assurance system is very centered in the quality of working conditions. And I think that it's very, very important to motivate and to the qualification and the training and the working condition of staff, of professionals, because I think that we have said that there is no quality service without the involvement and the qualification and the training of the professionals.
I think my answer might reflect where England is in terms of the number of agencies and bodies that are active in this place. And while that on the one hand is great, on the other hand, what can happen is different agendas can spring up and different organizations focus on their own goals. So something we have been pursuing and continue to pursue is getting to a place of consensus. So my answer to your question would be for agencies and for professionals at all levels, whether they're talking about national, regional or individual providers, is to work with the people who use services to understand their needs and their expectations and the challenges that they face. And for all agencies to champion a person-centered approach, as I say, at all levels, whether that's with an individual person or right the way up to system and national level. And that's the best way, I think, to develop a single shared consensus on quality that can underpin more integrated working, whether that's across health, social care and the different agencies there, but also crossing the boundary with health as well. And it can underpin a much more effective approach to sharing data and insight and information, all of which will make securing improvements in care that much easier.
The importance of the role of quality standards authorities, the importance of creating consensus across agencies and organizations, focusing on transparency and ongoing improvement. I mean, we've heard a lot about quality today, and with this, we've now reached the end of this ESM podcast episode. I would like to thank warmly David and Joseba for joining us to highlight the importance that quality has in social services and for sharing with us your personal experience of working on this topic in Spain and England. For our audience, thank you for listening. If you want to learn more about the work of ESN in the area of social services quality, follow the links in the podcast description. And stay tuned for our next episode. Thank you and goodbye.